I want to show you some data from the CDC and Department of Health. How many people in central Pennsylvania communities that you live in have a drug use disorder? Let's take a look right now. We're in Dauphin now. 5,700, a little over 5,700. Now take a look over here to Cumberland County. Cumberland County, 4,100. And now down to Lancaster County. Lancaster County, you can see over 8,000 people estimated with drug use disorder. Now back to that graphic, because this is Doug. Where my story takes us tonight is Lancaster County. Doug was found dead 10 hours after injecting a fatal dose of heroin and fentanyl into his body. And this is his wife, Diane. She too suffered from addiction, but it wasn't Doug's death that led her to her recovery. It was someone she hadn't even met yet. Here's Diane's story.
This is absolute rock bottom. I had nothing to live for anymore at this point in my life, and I just didn't care about anything.
High on heroin and Xanax, Diane Battaglia-Hutton was pulled over while driving on the wrong side of the road and arrested for DUI.
In all honesty, I don't remember it. I remember waking up. I briefly remember being in the hospital and having them take my blood. And then I remember waking up in holding cell at the police station.
1 month before her arrest, Diane's husband, Doug, had overdosed on heroin and fentanyl. He was found 10 hours after injecting the deadly dose of opiates into his body.
His parents called me and they told me the news, and it was just, he was my soulmate, my world, my everything, and we were using together for a long time.
The couple's addiction started with pills.
I would get prescribed probably about 180 Oxy 30s a month, and between me and him, we would go through in about 4 days.
When doctors stopped writing Diane prescriptions, she and her husband got hooked on heroin.
We found the heroin was much easier to get and much cheaper at the time.
Diane needed help, so she checked herself in to Retreat Behavioral Health in Ephrata.
The first time I came here, this is my only time here. I'm going to be the person who goes to rehab once, and it's going to be it.
But she was wrong. Over and over again, Diane found herself back in treatment until the 5th time, when she didn't come back alone.
I was pregnant. I was 8 weeks away from giving birth, and I was scared to death that they were going to take my baby.
She and her roommate were both pregnant at the time, and they both relapsed on heroin together.
It breaks my heart that I used while I was pregnant with her.
How much were you using?
We were using a lot at that point. Dr. Dively is amazing. She saved mine and my baby's life.
It's hard for pregnant women to get help because they're afraid people are going to judge them. Number two is there's not many places they can go for help.
It's because of that reason the board-certified OBGYN helped start the pregnancy recovery program here. According to the CDC, the number of women with opioid addiction at labor and delivery more than quadrupled from 1999 to 2014. That includes prescription opioids like oxycodone, for example, in addition to fentanyl and heroin. Dr. Dively has treated more than 130 women who were pregnant and addicted.
The biggest problem with babies of moms who abuse opiates is that they're born addicted.
Neonatal abstinence syndrome is a group of conditions caused when a baby withdraws from certain drugs, most often opioids, when they are exposed to it in the womb. The latest data from the CDC from 2014 shows a baby was born with neonatal abstinence syndrome every 15 minutes in the U.S. That's nearly 100 babies every day.
Some babies can be in the hospital for months till they go through the withdrawal process.
Amazingly, Diane's daughter Ryan was born healthy.
She's done amazing. She's meeting all her milestones. She's a happy, smiley, giggly little girl.
Then Blues had a baby and they named it Rock and Roll. I couldn't have pictured a life better than I have with her. She's my world.
Yay!
And the woman in this picture?
She's never gonna have to see that person. She'll never have to know that person, because I am gonna be there for her for every single moment of her life.
Incredible story. It lays out the problem, but you also uncovered another niche problem, I guess you could call it,
Right.
especially when someone is expecting.
Yeah, because only a few places in the whole United States can treat women who are pregnant if they have an addiction. So Retreat Behavioral Health in Ephrata is one of just a few. So 132 women they've seen so far and helped in recovery. So if you're at home, you're watching, you're pregnant, you're addicted, you're an alcoholic, it's not too late to get help. You need to see Dr. Dively. She's amazing. She saved, as Diane would tell you, her life and her baby's life. So please, don't be embarrassed, don't be shy, get help, because there is help there, especially here in Central PA, which is crazy because it's so, you know.
Excellent reporting. Great story. And again, reach out if you need help.
Yes,
Even if they need to reach out to you or us here at CBS 21.
That's right.
Thank you, Jasmine.